are dead and gone. That Vedrajan knows. So, doctors, they misuse their health. And it is, today the trend is doctors, they prescribe unnecessary medications also. Too many medications. I used to see our professor's prescription, maybe 1 or 2 drugs, not more than that. Today, doctors, they have a big list of drugs on both sides of the prescription pad. 2-3 painkillers, 2-3 multivitamins, 2-3 antibiotics. It's called as a shotgun therapy. One drug or the other will work. Today, that's a trend. Also, drug companies, they take care of the doctors to promote the drugs. One of the most corrupt industries is pharmaceutical industry. So we need to understand the limitations. I'm talking about the limitations what we have. I'm not saying that drugs are bad. I'm not saying that allopathy is bad, but we have limitations. So how to overcome that? So we should become wiser to protect our health so that we do not become patients. We don't want our family members to become sick and patients. So we must use drugs very, very judiciously. We should not misuse drugs. That's very important. At the same time, my request is, pass on the message to your friends and relatives that they should have regular checkups. Especially, ladies, because there is a tremendous increase of breast cancer, cervical cancers, ovarian cancers. So you need a regular mammogram, pap smear, because WHO is focusing on that only. Women's health. WHO doesn't have any separate program for men, because WHO knows that men will not listen. They will smoke and drink, except DXN members. But I see a lot of DXN members also smoking. They will do everything. Whom are you cheating? You are cheating yourself. You are cheating yourself. So when you say something, when you do something, you need to be the first example. You should consume DXN products. You should follow what you say. Then only you will be accepted as a leader. So let us, first practice that, and let us first make our family members to consume DXN products. I always say DXN products should be on the dining table, not puppets, pickles, chips and other items, poisons. All those poisons should be away from the dining table. So we need to set an example for ourselves, and just consuming 1 or 2 pairs of RGGL is going to give all those health benefits. And for a sick person, he needs more Ganoderma, probably about 3 to 6 pairs of RGGL. And only in cancer, you need to have a high dosage so that it will have that anti-cancer effect. And today, worldwide, a lot of cancer patients are benefited because of consumption of Ganoderma, along with other medications or treatment modalities. As I mentioned, radiation, chemotherapy, surgery. For some cancers, we do not have any medicines, any treatment. Pancreatic cancer, sarcomas, some of the rare tumors. And even today, pancreatic cancers, the longevity can be more. As Steve Jobs, he lived up for 7 years. Previously, we used to say, patient cannot survive more than 2.5 years when he is diagnosed of pancreatic cancer. Today, because of better treatment, better medications, surgical techniques, maybe that the life can be extended. But best is prevention. Prevention. So for prevention, food has to be a medicine, and nutrition has to be medicine. So both powerful products are with us in DXN, and Ganoderma can be very useful for cancer prevention. So, food definitely has got a great role to play in maintaining our health, and not all food can be taken, because for a person with diabetes, sugar becomes a poison. For a person with kidney disease or heart failure, salt becomes a poison. But Ganoderma can never become a poison. It will act only as a medicine. And when you go through the websites and literature, you have enormous research material available on Ganoderma. It's quite unfortunate that we allopathic doctors, we do not have any knowledge about Ganoderma, and we refuse to believe. And I was lucky in knowing about this Ganoderma thanks to my sponsor, Dr. Ratna and Professor Vaspalaya. And being in DXN, my lifestyle has totally changed. I am natively free man now. I can take off from my routine practice, and because the DXN income is supporting me, and that is without my knowledge, that DXN as a double diamond, I am getting a good residual income. Otherwise I have to work. And I resigned at the age of 49. I was a professor of cardiology in RANJAN Medical College, and 12 years back, I resigned. And after that, I never got into any of the medical colleges or for a job. Today, the offer for a teacher as a professor of cardiology in Tamil Nadu is around 3 to 5 lakhs. Easily. But I am able to resist that because I don't want to work under somebody, folding hats. At least that partial freedom the DXN has given me, and I am able to travel, and make lot of friends. And one of the biggest, the asset what I have created in my life is, lot of friends. Money, of course, my grandfather has given me, my father has given me. And I was sharing with Dr. Gangwal that my father was one of the senior cardiologists, pioneer cardiologists in India, along with Dr. K.K. Date, Sujai B. Roy, Dr. Padmavati, and my father. So I was lucky to be born as a cardiologist's son. Not with a silver spoon, but with a golden spoon. But in DXN has given me another different kind of opportunity, totally new, and I enjoy doing it every minute, every day. Initially, I had a lot of hurdles from my own family, my mother, my wife. And today, all of them are supporting me, including my mother. People who are now, know me, like Dr. Ratna and the professor, or Nemi or Killi, they have all come, Dr. Ethirajan, And it took me 10 years to convince Dr. Ethirajan. I know. He is my very close friend and 2 years senior to me in the college. And he is promoting Ganoderma now very seriously. Because it's a question of, understanding the power of Ganoderma and the concept behind it. So Dr. Lim Sujan has given us, all of us, an excellent, an opportunity to promote health to our family members and brothers and sisters at large. So we're all fortunate to be here to hear from so many experts. When we started, we never had such kind of training or knowledge, whatever. We all learned in a very hard way about Ganoderma and other products and DXN system and networking. And my guru, Professor Vaspalaya, in network marketing, he taught me a lot of things. And with that, that skill only, I could get people like Dr. Etiraj. And tomorrow you will be hearing from him. Such a wonderful person, very senior person, highly respected person. And why all of us are here? Not for money, but we want people to get help. And that's a great cause. And such a senior cardiologist, he has come all the way from Pune. And it's a great social service what you can do through DXN. So, I am fully committed to DXN. But it's unfortunate that, I have to carry on my profession as a doctor. The moment I go to Chennai, I have to become a cardiologist and I have to do all my professional work. It's something like, managing 2 wives. Very difficult. I always say that cardiology is my first wife and DXN is my second wife. Because that level of commitment, I have towards DXN, and the values what Professor and Dr. Ratna have taught me, I must be grateful to them. And recently, I had been to Pune, sir, for this Ayurvedic conference, World Ayurvedic Conference. I had a half-an-hour session, talk on Ganoderma. And I called the country manager, Guptaji, and said that my wife is undergoing surgery. It may be difficult for me to go to Pune. He said, Doctor, there's a big conference. I would appreciate if you can just make it for a day. After that, I was supposed to go to Mumbai. And then they caught hold of Ajay Ramani. And he was able to substitute me for Mumbai, right? I was just fair for a day. Just one night I gave the lecture and came back. Because that level of commitment, I have towards DXN. And that commitment came after 10 years of long association with DXN and whatever my mentor has taught me. It's all a nice feeling to be in DXN, and especially what Professor is doing through Vasapal creation is something tremendous. Yeah. And I don't think in any other network a leader will do that. So selflessly, with so much of sacrifice. And any number of times I have told both the doctor and Dr. Ratna and Professor Vaspalaya, don't stress so much, sir. You have a great future in DXN. People who are just starting, people who are just, trying to learn, build their network. They have a great future. And my thinking is the growth of DXN from now is going to be very, very fast. Those who sincerely build DXN business. Because we struggled for 10 years, 11 years, to get that kind of a leverage. Now, you have all the expertise, all the information, the system, the powerful system, and I want you to use that knowledge and information about the products and the network, and I'm sure that all of you will become Crown Ambassadors. Thank you for patient hearing. Thanks a lot.